This is Dr. Anina Abraham from Advanced Retina Care Hyderabad. Today I'm going to explain what uveitis is. Let us first look at this picture. We're going to understand what the uvea is. Uveitis, as the name implies, simply means inflammation of the uveal tract. Now, where is this uveal tract? Now, let us look at this picture. I'm highlighting it blue. There are three layers. There are three coats in the eyeball. One is the sclera, which is the outermost coat. Then you have another layer, which is very vascular, called the choroid. And inside is the layer called the retina. The uveal tract comprises of the choroid, the ciliary body, and the iris, which is in front. Now, what is the iris? The iris is this colored portion of the eye that you see in any individual. This is called the iris. So even if this is inflamed, we can call it uveitis. There are three types of uveitis. Number one, you have anterior uveitis. As the name implies, anterior means in the front portion of the eye. Now here the changes you will see are, number one, you'll have lots of congestion. If you can see, this whole part of the eye is red. In fact, the redness will be 360 degrees all around this portion of the eye. The patient typically has glare, severe pain in the eye, and is unable to face light. Now, what you see here is there are some changes which happen in this portion of the eye, which is actually in the back of the cornea. The cornea is the transparent portion in front of the eye. So behind that we see some deposits. As you can see here, there are some deposits. Then we see some reaction in the front portion of the eye. We can call it some anterior chamber reaction, which is, you'll see some cells and flare in that portion of the eye. There is a chamber there, and that is full of cells, inflammatory cells. And with time, what happens is something called posterior synechiae develop here, which attach the iris to the lens of the eye. So this is an anterior uveitis. It's very, very obvious that a patient is suffering from anterior uveitis because of the severe, intense pain that he has. And as a process, because of all this happening inside the eye, there is some amount of blurring of vision as well. But if you see a person with severe redness in one eye, and the eye is so inflamed that the pain becomes unbearable, the patient is not able to go out into the sun, he needs a checkup immediately. The second type of uveitis is an intermediate uveitis. So this is neither right in the front nor is it right at the back. So what the patient has here is something called floaters. Now you see there are white spots here. These are called floaters in the vitreous cavity. So what happens is something called vitreitis, which is the vitreous inside the eye becomes inflamed. We call it vitritis. So the symptoms here are a little different. You may not have any pain, and sometimes the blurred vision also may not be so bad. The patient mostly complains of disturbing floaters. Now, when does the vision actually come down? When the center portion of the retina, called the macula, which is in this portion, when the macula gets inflamed, we call it a cystoid macular edema. When swelling comes in the retina, along with this vitreitis, you have a lot of blurring of vision. This patient would need some injection inside the eye. So as you can see now, there are two types so far. In this type, the patient does not have to have pain or redness or any of those symptoms, but disturbing floaters. Yes, definitely you can think of uveitis. The third type is the posterior uveitis, which happens in the back portion of the eye. Now here, this is a picture of the retina, and something has happened here. Some yellowish areas have formed on the retina. So what has happened here is something called a choroiditis, which is the layer of the choroid has developed an inflammation. Now this mostly happens in infectious conditions and needs to be treated aggressively because this can cause severe vision loss. Now it is important to understand that you can have anterior with intermediate and posterior uveitis. You can have each of these uveitis manifestations individually, or you can have them all together. So each time you have a symptom, you need to understand what the type of uveitis is. Treatment will again depend upon the type of uveitis, how severe it is, and definitely the cause for the uveitis. Many patients ask this question: why have I got uveitis? Why do I have inflammation inside the eye? Has it just happened just like that? Is it because I'm watching the TV, or is it because of something else? Now there are many causes for uveitis, and that's the reason why we recommend screening, blood tests, chest x-ray, skin tests. So many other tests are recommended to find out the cause for uveitis, especially if it has recurred in a patient. These are the common causes of uveitis. Infectious causes, we need to rule out toxoplasmosis, which is very common, and another one which is extremely common is tuberculosis. Patients many times deny having tuberculosis, but this is one of the most common causes in our country. If you can get to the history of a family member having tuberculosis, it is very much possible that this patient also could be having tuberculosis. The tests need to be done. Apart from this, there are various fungal, viral infections which can cause uveitis. Then there are other systemic conditions like ankylosing spondylosis. If you see this in a young man, you can have something like Behçet's disease in a young man. Then again, you need to look for joint pains, arthritis, other conditions. So there are various reasons for uveitis. And again, uveitis can develop because of ocular disease itself, like somebody having sympathetic ophthalmitis or glaucoma or tumors can also have symptoms of uveitis. If you have any more queries, you can contact us on this number.